Hello, welcome to the Inland Coalition on Aging's webinar on the Inland Empire Master Plan for Aging. We'll be discussing community resources today. My name is Elizabeth Bogomil and I'm going to be your host. I've served as consultant for the Inland Coalition on Aging for the last 2 years, about 2.5 years. As part of the role, I conducted the needs assessment. I helped facilitate the working groups with community stakeholders, engaged in stakeholder and community outreach, and I'm supporting the forthcoming IE Master Plan for Aging, which is coming out this June. Hopefully you're all able to register to attend our release. Please do so at inlandaging.org. So during our needs assessment, when we were talking to community members about what they needed within the Inland Empire and kind of gaps in services, we discovered that a lot of resources existed already, but community members were not aware of it or unsure how to get connected into those resources. And so that's contextualizing today's conversation, where we're going to welcome Ben Winker, Community Outreach and Engagement Specialist at California Health Advocates and Senior Medicare Patrol, Jamie Villalobos, Territory Sales Representative for the Inland Empire at Shield Healthcare, Scott Swanson, Senior VP of Sales at Hannah Interpreting, and Delia Orozco, Director of Community Wellness Centers at the Inland Empire Health Plan, IE-HP. So we're going to welcome them all today, and they're going to speak with us a little bit about resources that are available to community members in the Inland Empire that are going to support the aging process and for those who are disabled and caregivers. So Ben, can you tell us a little about California Health Advocates and Senior Medicare Patrol?
Yes, the California Health Advocates is a statewide agency that provides Medicare fact sheets, trainings on Medicare, and also runs the Senior Medicare Patrol, which is a Medicare fraud prevention educational program. And I'm the community outreach and engagement specialist, so I come out and do presentations. I work with different groups on events, and we do a lot of training. We're training new high cap health insurance counseling and aging program counselors right now. So we do a lot throughout the state.
Nice. Thank you, Ben. And in a little bit, you'll give us some more details on how to get some information and be supported by y'all. Jamie, will you tell us a little bit about Shield Healthcare?
Yes, absolutely. So I'm with Shield Healthcare. We provide disposable medical supplies for just about anybody within the Inland Empire. We work directly with your insurance to provide you supplies such as oral nutrition, incontinence supplies, diabetic materials, and catheters.
Thank you. I look forward to hearing more about the resources that you have available as well.
Thank you.
Scott, can you tell us a bit about Hannah Interpreting?
Thank you, Elizabeth. Happy to do that. We're a San Diego-based interpretation translation company. Been in the business about 14 years, actually founded and owned by our current president, Tom Hanna. And we do both on-site, face-to-face interpretation. We do remote interpretation, and then also written translation work throughout the state.
Wonderful. And I also look forward to hearing more about how to take advantage of those resources. And Delia,
Definitely.
can you tell us a bit about IEHP?
Sure. Thank you, Elizabeth. So I'm Delia, and I appreciate you saying my name correctly. So thank you. We are a health plan. Inland Empire Health Plan is a health plan, and we've been established by the two counties of San Bernardino and Riverside. And we've expanded to serve over 1.5 million members in the region. We have almost 4,000 employees that work for the company. So that sets us as one of the largest employers in the Inland Empire. And so IEHP serves the Medi-Cal population, our Medicare population, and now covered California. So as the director of our community wellness centers, I am thrilled to be here today and share the fantastic resources that we have available for everyone.
Wonderful. Thank you all. We're so glad to have you here and to learn more about resources that are available to individuals in the Inland Empire. Jamie, so you talked about how Shield provides disposable health care. support. But can you tell us also about some of the newsletters and webinars and videos that are also accessible on your community?
Absolutely. So we have a wonderful website where you can visit. It's open to everybody and anybody. It's www.shieldhealthcare.com. And you can check out the community tab where we feature all kinds of videos, informational videos in regards to incontinence care, diabetes management, oral nutrition products, as well as catheter supplies. We also have a whole site dedicated to providing information for family caregivers as well as healthcare professionals at home. And so, again, the goal for us is to work with your insurance, the Medicare, the Medi-Cal population to provide you disposable products. For example, if you're having issues with incontinence, you might not know that your insurance covers those types of products. So what we do at Shield Healthcare is we work directly with your doctor and or your health plan to get you those products, and we deliver them directly to your front door. Same would apply to any of our diabetic supplies, our enteral nutrition, catheters, and even wound care.
Wonderful. It's great to know that you provide the products, but also a guide for community members on how to use them and engage with the
Absolutely.
products and make sure they're used properly. So Ben, what is the role of California health advocates and senior Medicare patrol in Medicare education and advocacy? And who is at higher risk for falling into fraud?
So the California Health Advocates was started back in, I believe, 1997, and it started because Medicare is a complicated piece of the puzzle to take care of people as we age, and it helped start the high cap program as well in California, which was replicated across the country and other states. Could be called state health insurance programs or SHIPs in general. A lot of them have different names, but we do a lot of Medicare counseling with people, help people understand their options and education. And we also do policy advocacy. So if we see a bill that supports the Medi-Cal population or the Medicare population, we write letters and we put our support behind those things. So we also help people with their rights and protections for Medicare beneficiaries and their families. So we're training a lot of caregivers, we're training a lot of providers, and teaching people about Medicare. And on our website at cahealthadvocates.org, um, cahealthadvocates.org, you can sign up for Medicare fraud alerts, Medicare updates, and free monthly webinars where we bring in experts to help you understand or anyone understand Medicare better. And then so on our website, we have a great bunch of fact sheets and educational workshops, as well as a lot of updates about what's going on in Medicare. And the third thing that California Health Advocates does is the Senior Medicare Patrol. And as you can see right here, our motto for the Senior Medicare Patrol is prevent, detect, and report. The most important part is preventing Medicare fraud by education. And then we also an advocacy. And if somebody does realize that they inadvertently given up their Medicare number, they can call us, report that fraud or report that scam, and then our fraud investigators work with them to find answers and get people out of certain programs or re-signed up with what they have. So it's a really wonderful program. We save millions of dollars and put that back into the Medicare bucket. So prevent, detect, report. Use your Medicare summary notices. Read your Medicare summary notices and explanation of benefits, and keep a journal to keep everything straight. So it's a really broad program, and we're really happy to be here and share about it.
Thank you, Ben. It sounds like a really important program for both caregivers and for those who are receiving supports.
Yeah, could I throw in? I did answer your last
Yeah.
question. Who's at risk of falling for fraud? And really,
Yes,
it's
yes.
everybody. It's really everybody. It comes through your bank on your text phones. It's a romance scams online, email phishing, trying to get you to respond to something. USPS notifications on your texts, and then people that are older might be a little bit more socially isolated. So somebody
Mhm.
promising great things, it can be a great conversation for people. And so, our seniors and as we age, we're becoming more isolated. Our partners might have passed away or moved away, such things, and so everybody is really at risk of falling for fraud. Sorry, I wanted to catch that before it went away. Thank you.
No, definitely. That's really important. We have done community presentations in the Inland Empire. We just did one last week. And this topic came up of how do you prevent fraud, Medicare and otherwise. And so this is a really important topic. And it came up with community members who are receiving this kind of
Oh, good.
support. Yeah. So Scott, can you tell us a little about why it's important to have access to interpreting and translation services and also who seeks your services?
Great question, Elizabeth. So, just to back up just a little bit, more on Hannah. Like I said, we're in San Diego. We have regional offices statewide. We are the fastest growing interpretation company in California, and certainly we take our Hannah promise very importantly. We want to deliver more than just words. That's our ethos, connecting communities through language and the human touch, and then finding that white glove service all in one language service provider, if you will, and being innovative. So, when you look at language access, it's important not just because it's the law, because it is, but also more importantly, it's the right thing to do. And especially in the aging population, it's a difficult time to navigate healthcare, but to be able to have the right kind of language access to make sure when you go see your physician or you're going through discharge, you have the appropriate either face-to-face in-person interpreter or you have the right type of documentation to support your visit. So we support, you can see a number of healthcare plans throughout the state, and we are actively involved in not just providing face-to-face interpretation, but also looking for ways to be innovative to be able to say, okay, what is that experience for that patient when they come up for the doctor's office? Or more importantly, what is that experience for the provider when they have the face-to-face interpretation session? Are they getting notified in time? Are they getting the confirmation for the interpretation session? So we want to be, not just a transactional vendor, but also a strategic relationship partner. So it's a seamless situation where language is a conduit and not just an afterthought. And also it's been proven out when it comes to language support, you're going to have better patient outcomes, you're going to have a better member experience, and it reflects more highly upon the organization.
Wonderful. So, can you give us some examples of languages that your organization can offer translation
It's a great question. We have support in over 200 languages, so I would be hard
Wow.
pressed to tell you any language that we can't support. Now, I will say there may be languages that are a little more difficult to source, but given the right type of time and resources for the availability, we're confident we can get any kind of language support that people need.
That's
Wonderful.
awesome.
This was definitely a topic that came up in our needs assessment, making sure that community members had language support. Um, Medical language can be very complicated. So if English is not your first language and that's how it's being presented to you, it can be really complicated to understand. So it's nice to be able to have
Exactly.
language
And I would
support.
just add one more thing too, the tendency for an organization to find resources internally when they're not qualified interpreters or to rely on family members is tempting, but not always the best avenue from a liability perspective and accuracy perspective, and just doing the right thing for the patient and the organization.
It can provide a lot of pressure on family members or especially children if children are interpreting for their parents.
Yeah, absolutely. Think about that. If, a 16-year-old has to interpret for her grandmother, that's a lot of pressure on them. Plus, there may be personal things that are inappropriate for that conversation with family members, or more importantly, somebody down the hall who's not an interpreter. Maybe they're on staff. So, let's do the right thing, get a qualified interpreter. And then also, from a timeliness perspective, if the on site opportunity isn't always available, you can pick up the phone, call an interpretation session, and have it on demand too.
Wonderful. Thank you, Scott.
You
And
bet.
Delia, what are some of the community wellness centers that you have in the area? Where are they located? What type of services do they offer, and who can use them?
I love this question. So thank you for asking. Our community wellness centers, if I can start here, the most important goal is to enhance well-being. We focus on prevention and really aim to help our members live healthy, fulfilling, vibrant lives. We do this by offering a wide range of classes and services designed to do just that, improve the quality of life. So our mission is to empower folks to take proactive steps towards their wellness, ensuring that everybody has the resources and support they need to achieve their goals, their health goals. So our centers become a one-stop shop for all things health, like fitness. Think Zumba, yoga classes. We have health education classes, so think like diabetes education. We also have a caregiver support group, nutrition, so fun food demonstration classes, wellness, and then think meditation, right? Meditation, gardening, things like that. So our classes and workshops are really designed to educate and equip individuals with the tools to manage their health proactively. And even a bit of social service magic. So people come into the centers looking for resources on food, housing, employment, and we are able to provide current information on those necessary resources because we really do believe in the power of partnerships. And that really helps us make a big difference in our community because we're working together. And so while we promise to give a good time, we're a lively bunch. I can't help it. We're a fun group. The centers are super fun at places to be, but our programs are more than just a party. They're the reason the folks come in is because we're bridging the gap between fun and informative classes and workshops and then top-notch clinical services like vaccine clinics. We want to make sure our seniors are taken care of, right? So once you come to the center, you want to keep coming back because aside from providing health, wellness, social service programs, clinical services, aside from that, you want to come back because you're making friends, and everyone likes to have friends, right? You're building connections, you're getting support, all while getting these other needed services. So we're truly committed to being the cornerstone of a vibrant life. And I will say our seniors are our numero unos, right? They're our ride or dies. They're the folks that come and they'll stay all day if they could. But they come and we're not an adult daycare, but our seniors are the ones joining the classes and they will tell us what they like. They'll tell us what they don't like, but they're there. And I've seen so many stories where our seniors, even other adults, from various ages, they'll come in kind of down and they're just, my doctor sent me here. I don't know why. And we're like, okay. And our teams start to have conversations with them and we start engaging them and getting them plugged in. And then, after a couple weeks, after a month, they straighten up, they're walking, they've got that pep in their step. And so it just turns out to be, they're building a social support structure. And it's the most fun to see and to witness. And I'm always honored and humbled and to be kind of the observant of that change lives. And it's truly amazing to witness. So we are located in the city of San Bernardino, city of Riverside, and Victorville, our awesome high desert community. So I encourage anyone to come by. Everyone is welcomed, and we serve folks of all ages, from zero and up.
Wonderful. So they don't necessarily have to have IE-HP as a health provider in order to participate in the wellness centers.
No, we're open to everybody. Anybody is welcomed, and it's free. Everything is free.
Wonderful.
Awesome.
I know in the conversations that we had with community members through the needs assessment, they were explaining how important social support is. And it's harder to create those communities as you get older, as you have less mobility around the community and less connections. So
Yeah.
it sounds like a great place to build them.
It is. It's true. And honestly, when I'm walking through the centers, any one of our centers, you definitely see the seasoned adults, and they're champion people. Like people walk through the door and they're like, "Welcome, welcome." You know, they become the greeters of the center. They become the quick connections, those quick points to help people feel welcomed. And so we really love our seasoned adults. And so it's pretty awesome to see that social support structure being built in like real time.
Nice. And it also offers intergenerational activities with all
Mhm.
ages, which was important to the community members that we spoke with.
Yep.
Wonderful. So, question for everybody. How does your organization reach clients? How do you engage with clients or find those clients? And what challenges do you see people come across? And how do they overcome those challenges in terms of becoming clients or engaging with y'all? So we can start with Ben.
So I was hired last June, and before that, I was a high cap program manager for Humboldt and Del counties. I did that for 4 years. As a I worked in the program for 4.5 years, but I was program manager for four. And I moved towards the California Health Advocates and the Senior Medicare Patrol because I get to do presentations throughout the state and actually meet with 40, 30 or 40 people at a time, do a PowerPoint presentation, talk about fraud prevention education, listen to their stories, and share our resources. So we do have fraud investigators, we do have educators, we do have people that have been working in the Medicare field as counselors for a long, long time. So there's a lot of answers for a lot of questions. So going out in the communities, being at tables, being at events, I pass out my card and people call or write and they can request a presentation on our website. So we reach clients like that, and then we also reach clients through the health insurance counseling and advocacy program that's in every county in the state of California. And so people might have questions that go beyond the scope of their counseling knowledge. So they'll ask us for help on deeper dives on long-term care insurance counseling. People have these great plans, but they're not sure exactly how to use them. So that they can reach out to us, and we're really happy to help. Um, with my program specifically, Medicare fraud, people have experience seeing, spam messages on their emails, getting texts saying that they won a prize. All of a sudden somebody reaches out to you through Facebook, and they're really engaging, and they want to be your, again, partner, boyfriend, girlfriend, in the later years, and people are excited about that. So people can get really easily led into a scam or fraud, and we really want to support them. We want to use positive language and not demean or belittle somebody that was scammed, because we want to know about that experience and know what the scam was, so we can flag it and then collect more of those and say, hey, there's a problem going on in Tustin, for example, or some other part of the state, and Fresno or Sacramento or even Humboldt, and try to rectify that. And so we do actually answer a lot of calls and elevate those fraud scams to the OIG, Office of Inspector General, or we're able to do that in house and help the client beneficiary get out of a program they didn't want, or feel like they signed up for. So it's a means of our a website, longstanding in the communities, and being in California for so long. So people know to reach out to us. They know we have fact sheets on Medicare, and they're ready to ask questions and get help.
Wonderful. Thank you, Ben. And so your website has more information on how to reach out and engage.
Yes, a lot. cahealthadvocates.org. And so on that website, you can look up Senior Medicare Patrol 2 if you have concerns about fraud. There's a whole website of documents and information. And if any of your my fellow panelists need a presentation or Medicare information, let us know. And we'd love to send you information on fraud prevention, on Medicare advocacy, and those kind of subjects.
Excellent. Thank you. Jamie, do you want to tell us a little about how your organization reaches clients and what challenges you see your clients encountering and how they have overcome those challenges with your services?
Absolutely. So, pretty much you will see me throughout all of San Bernardino County. I make it a goal to visit every doctor's office, home health agency, and hospital within that area to provide the resources in regards to helping patients get the supplies that they need. I think the biggest struggle that we see is that a lot of people, especially our elder population, they don't know what services are available to them. They really don't. Know that insurance, specifically Medi-Cal, covers diaper supplies. And so a lot of times they either go without the supply because, it's costly, it's expensive to purchase these products, especially when you live on a budget. And everybody knows right now, everything is so expensive. Inflation is crazy. And so a lot of times, if you only have so much money, buying diapers can, even though it's a necessity, it may ultimately come down to being a luxury for you. And if you need groceries or pharmacy, or you just need to pay rent, you don't buy the supplies that you need. So, what we do is we work specifically with everybody in the community to provide the education and the resources to let you know, hey, your insurance covers these. You don't have to go without, you don't have to borrow from your neighbor. You don't have to skimp on product. That's what we do best. And so I work with a team here in the Ontario office, and we, like I said, work directly with your doctor and your health plan to secure your prescription. If you have IHP, they're a wonderful, wonderful health plan. They care a lot about their clients and the community and the patients. And so we work with them to get you an authorization. So we do not expect anybody in the community to take care of that paperwork side of it. That's what we do best. So we will work with your doctor. We will let them know this is what you need. This is the paperwork and documentation we need back to get you those supplies. So again, it's really just about providing resources and information. And a lot of times too, I'll meet nurses and caregivers who don't know that these services are even covered. So they're not referring them to us. And so, if there's an opportunity where I can come out to a community event and provide brochures and information, sometimes even samples, I'm happy to do so.
Wonderful. And what is the best way if a community member wants to make sure their doctor has information on your organization and how to engage? What's the best way to do that?
Absolutely. So we strongly recommend either reaching out to your primary doctor's office. Typically, every primary doctor has a referral coordinator. Let them know you'd like to be referred to Shield Healthcare for your disposable medical needs, or you can self-refer. You can call in directly to us. We do have a 1-800 number. You can call in. It's 1-800-557-8797. Go ahead and let them know you're a new client and you would like to get some more information on the services that we offer. And if for any reason you're hesitant to place an order, you're welcome to request samples up front. We're happy to get you some samples delivered directly to your front door. Try the product out, see how you feel about it. I guarantee you're going to love it. Give us a call and then we'll take care of the rest. We'll work directly again with your doctor and your health plan to get you the correct paperwork so that we can get you an order shipped out directly to your front door.
Thank you so much, Jamie. And one last question. Is the shipping fairly discreet?
So yes, the shipping comes in a brown box. There's no labeling other than your name on it. So your neighbors don't need to know what's in that box. Nobody needs to know your personal business. It comes directly to you every 30 days, which is wonderful. We ship directly to your front door. So if we have people in the community who don't have a vehicle, maybe they only have a caregiver a couple of times a week or a few times out of the month, so they don't always have access to go shopping, no worries. We will deliver directly to your front door, and you'll be able to get supplies every 30 days. So that's great. That's a wonderful resource for sure.
Excellent. Thank you, Jamie. And Scott, will you tell us a little about how Hannah Interpreting reaches their clients, how they engage with their clientele, and then what challenges you've seen people come across and how they've overcame them? Maybe a specific story or experience that you've had.
You bet. Thank you. So we engage directly with the healthcare plans for coverage. And that slide previously showed you the expanse that we have within the state for all the types of healthcare plans for coverage. working with providers directly too for sessions that are coming up. They may have appointments. They want to get an on-site interpreter in the office at a particular date for a particular language, so we can work directly with them. And then also having the availability for remote services. If somebody wants to pick up the phone and call for an on-demand interpreter, having that awareness of our services remotely is really important at the provider level. So the awareness comes both through the healthcare plan directly to the provider, and that is the most direct way within healthcare for that. Other verticals that we service is a little bit different, but it really is getting the word out through the plans, working directly with the healthcare plans, and then also with the providers to reach out to us for that interpretation and translation need. And we are actively working with many plans through an RFP process to onboard more plans through the state, and then certainly go directly to healthcare plans also to expand our services.
Wonderful, thank
I was going
you.
to say some of the challenges I think would be going back to, it's a competitive environment. I think some of them have touched on this in the panel. So we pride ourselves on service in our industry. Just to give you some background, putting an interpreter in a hospital or in a provider's office physically is quite the challenge. So from a fulfillment perspective, a lot of companies only have maybe an 80% fulfillment. At Hannah Interpreting, we have a 99% fulfillment rate. So that is a challenge to have interpreters live in person in front of a patient and the provider 99% of the time. So it's a matter of working very closely with the providers, very closely with the healthcare plans, and making sure we resource appropriately and we do it in an organized, systematic way to provide the best service possible. So it almost becomes beyond a talent perspective for having the right interpreter of quality. It almost is a logistical perspective too, to make sure we've got the resources to get that person in the right place at the right time.
Yes, that is certainly a logistical.
And it's always appreciated when we get a little warning, if somebody calls like a week ahead of time and says, hey, I'm going to have an interpretation need, but we fulfill, 24-hour requests, whatever we can to have somebody, there as soon as possible.
That's good to know. So if there's an urgent turnaround, that is something that's feasible.
100%.
Excellent.
And I just want
And
to emphasize too, when the remote access is available or needed, you don't have to have somebody in person. You just pick up the phone and call us, video and or just over the phone audio.
Oh, great. So both of them as well. It's nice.
Exactly.
And Delia, can you tell us a little about not just IE-HP, but specifically the wellness centers and how they engage clients and reach clients? I know people can just stop by, but how do you engage community members and make sure they continue coming and back? And then what are some challenges that you've seen people come across and how have they overcame those by attending the wellness centers?
Our best promotion is word of mouth. People come, they invite their friends, family, and so when you walk into a center, you feel the energy; it's palpable, and so we're thrilled. We love that people that visit the center once, twice, or a few times in a month share that with others and share that with their loved ones to bring them in the center. So we're really thankful for that. IE-HP does boast an exceptional marketing team dedicated to ensuring that everyone is aware of various health plan benefits, including our community wellness centers. But the partnerships that play a crucial role in amplifying the reach and impact of our community wellness centers. And so by collaborating with these external community-based organizations and healthcare providers, we really extend our resources and expertise to corners of the community that might otherwise remain underserved. And so these partnerships allow us to tap into existing networks, fostering trust and engagement with individuals who may not have been aware of our community wellness centers or access our services, right? And so through our shared goals and combined efforts, we're really able to address specific community needs more effectively, ensuring that everybody has the opportunity to benefit from quality health care and wellness support. So this collaborative approach, it really um, not only broadens our impact, but it really strengthens the fabric of our community by uniting diverse groups who are really in pursuit of the common goal, which is health and wellness, right? So that's the good stuff. That's everything good in. And so, but however, despite the success of our community wellness centers, we face significant challenges in removing those social barriers that prevent communities from accessing, quality healthcare and wellness resources. And so these barriers often include economic constraints, limited transportation, and wellness resources. And so, um, to address these challenges, we remain consistent and steadfast in our commitment to equity. Right? I think that's the undercurrent of what we do. Right? It's equity. It's always evolving, always changing, and so we also have to remain consistent, steadfast, but also ensuring that we're meeting the needs of every individual, regardless of their background, so that they can access our resources for a more vibrant life. And so by consistently focusing on inclusive practices, we're really tailoring our services to meet the needs of the community, but we're contributing to build a healthier future for everyone. That's really our commitment, and not just for everyone. It's not just like IE-HP, we want to do this. It's like, no, this is my future. This is my family. These are my friends who are part of this vibrant community. So when I talk about strengthening the fabric of the community and working with partnerships, it's because my family lives here. My extended family lives here. My mom, my in-laws, my sister, my nephews, my nieces, everybody. And so I have a stake in this as well because I live here. This is my community. And so this is our commitment. Really, it's just to remain steadfast and make sure that we evolve as the community needs evolve, but just stay steadfast in our goal and in our mission.
Thank you so much, Delia, for sharing that. And thank you all for listening in on today's Inland Coalition on Aging live stream, specifically discussing the Master Plan for Aging and our local Inland Empire resources and supports that are available to you. And a big thanks to all of our guests, Ben, Scott, Jamie, and Delia. It was great to have you here, and I appreciate your presence and the insight that you've provided. I know I've learned some new things about resources that are available to me now, too. So if this is your first time tuning in, check out the other live streams on YouTube, introducing the Inland Empire Master Plan for Aging, discussing transportation, housing, caregiving, Alzheimer's, long-term services and supports, behavioral health, and we also have a really good live stream. I believe it's January's live stream on equity, which Delia was just talking about. So you can check those out on YouTube. If you'd like to receive updates on the Inland Empire Master Plan for Aging, or if you want to attend our Zoom-based launch event in June, please sign up for that at inlandaging.org. And stay tuned for next month's live stream on ableism and aging. I look forward to seeing you all there. Bye.
Bye. Thank you.
Thank
Thank you so much.
Take care. Bye-bye.